to see this.
You've worked on the Hill, you've worked in D.C., you're knowledgeable about it. We've got a list, I'm going to list scrolling on the screen right now. This is every medical organization or patient advocacy group that has come out in opposition to the bill. We would show you a list of medical organizations that are supportive of the bill, but we haven't been able to find any. If anyone out there knows of any, seriously, please let us know. Tara, how can any senator feel good about voting for this bill?
Well, you have to understand that there are, there's going to be special interest groups that are going to come out and advocate on one side or the other. So everybody has a certain stake in this. But the problem is that the Republicans are losing the battle, the PR battle. There are aspects of this bill that are good, and there are aspects of this bill that people are not going to like. But this is what happens when you go through rushing a bill through instead of putting it through regular order, which would be to have hearings on this. You would hash out the details. Not everything that Jimmy Kimmel has said is actually accurate. There are some things that are up for debate, and we should have that debate. But the Republicans, much to my chagrin, have blown the opportunity to explain to the American people in a relatable way, the way Jimmy Kimmel has. He's appealing to the heartstrings of people. Just like Bill said, he's a dad. People connect to that. The average voter connects to that. The Republicans get in trouble because they start getting into nuts and bolts and talking about federalism and on block grants, and all of that's wonderful for those of us inside the Beltway that like to have those policy discussions. But to the average person that's worried about, am I going to be able to pay for my health insurance, or because of Obamacare, the individual market is collapsing in my state because the exchanges are collapsing and insurers are pulling out. What am I going to do next year? This is not helpful for them. And yes, the Republicans are going to lose this PR battle, but I think that this bill is going to pass because it's the only way to fulfill a campaign promise and at least move the needle forward to reforming something.
Should that be the goal to fulfill a campaign promise? Come on, Tara.
No. The goal should be for better health care and better access to health care for the American people, right, which I think that this bill has some aspects of that too.
But
this is not
the
doomsday scenario.
With the fact checks that we've done and everyone that I've looked at, maybe everything Jimmy Kimmel said is not, 100%, but the fact checks are on his side more than it is on Graham Cassidy's side. And Cassidy keeps saying Jimmy Kimmel doesn't know what he's talking about, when as a matter of fact, he does pretty much know what he's talking about.
Don.
He's done his homework.
No, Don.
Yeah, okay, go on.
Don.
What about pre-existing? Let's talk about the fact checks. Pre-existing conditions.
No,
what does he have wrong? What does he have wrong?
First of all, he's entirely wrong. It's 100% wrong. It couldn't be more wrong.
It's not 100% wrong.
It's 100%
Show
wrong.
me the fact check. Show me the fact check.
Did you see Phil Mattingly's report before this?
I did see Phil Mattingly's report.
So number one, pre-existing conditions, you can't discriminate based on pre-existing conditions.
That's not true.
Number two,
it does not provide.
No. The concern is that people will be priced out of the market.
Matt, if you say something, I got to fact check you. Because the president said that pre-existing conditions, is it true? No, it does not provide the same sweeping protections of those with pre-existing conditions as Obamacare. Here's why. Prior to Obamacare, many people with pre-existing conditions found themselves branded uninsurable for life on the individual market. Even a bad case of acne or a teen may have gone without coverage. So it doesn't provide the same level of pre-existing conditions as Obamacare. It is just not true. What you're saying isn't true.
No, I am true. But the question actually...
They could simply change the law to make it mirror the ACA, and you wouldn't have this debate at all, right, Matt? Why not say insurers cannot charge you more if you have a pre-existing condition? We're done. But they won't do that,
The law specifically says, this bill specifically says that it has to be affordable and adequate coverage.
That's not defined,
for people. That is what this bill specifically says. Now, you could argue, we could argue the states, your state, California, by the way, could do single payer if they wanted, but Mississippi could. I guess it's possible that they could interpret.
Well, that's the problem. States could opt out.
But that is not what Jimmy Don. That is not what Jimmy Kimmel said.
That means that pre-existing conditions are not covered.
The entire soliloquy that Jimmy Kimmel gave is, first of all, PolitiFact said it's unverifiable. His information, no one mentions, comes from a left-wing think tank. I'm just saying Jimmy Kimmel does not have his facts right.
The American Medical Association
so are you saying it's better that if they waited for the CBO score and that way everyone could have the facts?
There should be a CBO score. I agree with that.
And one quick thing, you know why it has to be different? Because now the only way pre-existing conditions are covered is because we have a mandate. So healthy people have to buy insurance to offset people who are sick. They got rid of the mandate. So of course the coverage can't be the same for pre-existing conditions because no insurance company could underwrite all these sick people. I was an attorney. I did healthcare law. That can't happen. Common sense says it can't happen. This bill guts, it hurts Medicaid, changes from entitlement program, ends Planned Parenthood funding for 1 year, and it results in millions and millions of Americans losing insurance. We don't know the number because they want to score a political victory with the health care of fellow Americans. That's wrong. It's absolutely it's immoral. It's wrong, and people are going to get sick and die without coverage.
It's a perfectly fine public policy debate, right? Yeah. One person could say, "Look, I think the states should have the right to tailor, block grant it, and if California and New York want to do single payer, great." And if Mississippi and Alabama want to have different reforms, we have laboratories of democracy.
Then you can't say it's guaranteed.
That's fine. Or you could say, no, we should have a one-size-fits-all, top-down, universal. That's fine. What Jimmy Kimmel's doing, though, is he's not engaging in this public policy debate that we're having. He is essentially, because he has this huge platform and he's a comedian, and he has a very, I think, emotional story to tell. But that is demagoguery. That is not how we should be. We should not be. We should not be designing. We should not be making our public policy decisions based on an anecdotal story from one rich comedian in California.
So what's wrong with being a wait? What's wrong with being a rich comedian in California? You have a rich comedian, or you have a rich reality show person.
I'm against that too, Don.
So and he has a big platform too. What's wrong with wrong with him achieving his dream?
All I'm saying is we should not be designing. I would agree. Jimmy Kimmel is having a huge impact on this debate, right? And my point is, I don't think that we should be essentially, designing 1/6 of our economy and making public policy decisions based on an albeit emotional and maybe tragic example, but an anecdotal example of somebody who happens to have a TV show.
And he's advocating for a system. He's advocating for a system that. Well, hold on. He's advocating for a system that is actually is not working for millions of people in this country as well.
They don't have
shows.
I
know that. So that's why that's where the demagoguery comes in. And plus, this bill keeps most of the main mechanisms of Obamacare in place.
I've got to take a break. I've got to take a break, and then we'll pick this up on the other side of the break. We'll be right back. Bill, you'll be the first. Likely, possible, but not certain, because there's no CBO score. But you're saying he's absolutely wrong.
All the fact checks prove him right.
No, I thought it does. I said no. I didn't say it proved him right. I said the fact checks were on Jimmy Kimmel.
This guy because he's scoring points. The fact is, Don, that Jimmy Kimmel did not invite himself into this. Bill Cassidy invited him into it. He said the bill would have to pass the Jimmy Kimmel test. And so Jimmy Kimmel said, I have to now know what's in this bill because you're putting my name on this. So that's what got him thrust into this. And you know what? He's not doing this for ratings, and he's not doing this for attention. He's doing this for heart. The heart that was in his son that he had to get repaired. And he's feeling the same way about other people's hearts. And that's what he's involved with. He's not doing it for attention. He is a really honest, decent guy trying to do this. And his past as a comedian is garbage that is being thrown at him by people who are trying to undermine the serious point that he's making and legitimate point that he's making. And people like Matt are just trying to undermine that because they know he's being effective. And they're trying to throw anything at him that's really, I think, completely illegitimate.
The fact that he's being effective is, again, my point from earlier. See, I think it was, even though I agree with my friend Matt on the substance of this, I don't agree with the attack on Jimmy Kimmel because people tune that out. Bill Cassidy should not have come out and tried to attack Jimmy Kimmel on this. Instead, he should have been prepared for what the pushback would be. And, I mean, Bill Cassidy is a doctor. How many people know that? He's an MD. He specializes in things. And he
almost
should be out
every
there.
doctor's
Wait, hold on,
organization,
hold on.
almost
Right.
every doctor's organization in the country is against this. Why is he? Is it because he's a politician and he needs a win? Because most doctors who are
I
not
think
politicians
that-
are saying
no,
this is a terrible bill.
No.
The doctors' organizations don't support this bill.
But to be fair, Don, some of those doctors' organizations are politically motivated. Also, they have special interest groups, and there's other nuances within this for why they are or are not against it. Like, some get paid more
Every
with the
single
hospitals and
doctor's
Medicaid,
group,
all that.
every
Not-
single
Why would they
group.
They're
want to change
political animals.
Why
Obamacare?
not? Look, if we have this
Obamacare
big
upset
debate.
everything. They finally figured out how to, make
Game the
money,
system.
and now you
Right.
want to change it again? Of course they don't want to change it
Reality,
again.
Matt,
But my point is
instead
that
of
Bill
us-
Cassidy
but
should
Matt
be
and
speaking
Carol,
as a
fighting
doctor.
over this, instead of us fighting over this, we could have an answer from the Congressional Budget Office, right? But they won't wait till after September 30th because they need a win by September 30th. Why play games with Americans' health care when you really don't know for sure if pre-existing conditions are covered, if lifetime caps are back, how it's going to impact Medicaid, how the impact is Planned Parenthood. We're going to stop funding for a year. Wait for the score, but they won't because they're playing politics.
Okay, let me ask
Americans'
you guys
lives.
this, and I
That's
want
wrong.
honest answers. Please be honest. So, Dean,
Yes.
if this was being proposed by a Democrat, would you support it?
No, this is horrible. This is absolutely horrible bill
Okay.
for Americans.
Tara, if this was being brought by Democrats, would you support it?
As a fix to the current system now, as something to get away from Obamacare now.
If this was a Democratic bill, you would support it. Matt,
if it had bipartisan support, the way it is
so this
now,
bill does not
yes.
have bipartisan support.
No, but it could.
You can't even get
I'm
50
saying
senators to
because-
agree. You don't even have 50 Republicans on
Because
board.
no Democrat would bring a bill without a Republican because of the federalism
Okay.
aspect of this and the reforms of it. So it's a little bit of a loaded
Matt,
question, Don.
would you support this if this was a Democratic bill?
Of course.
You would support it.
Yeah.
Oh,
Yeah, but no Democrat would ever bring this
Okay.
because they don't view healthcare this way.
They were working
That's
in a
why
bipartisan
We saw what
fashion.
happened when Democrats did it. They brought Obamacare, which is imploded.
And they want
It's
to
not
do,
gonna
I mean,
work
they want
either.
single
And
payer,
they
which,
want
by the
right.
way,
And so do 60% of Americans.
well, the cool thing is,
Until
if this
they understand
passes,
what that means.
New York and California, I think they should just do single payer. I'd support that. Let them.
And they'd be able, they'd be able to do that under
And
this
if it-
bill if they wanted to,
And if it works, great. Then it's a model.
which is.
Single payer is the future.
Anything
Most
that passes
60% of
the
Americans
bathroom
want that. That's the future
Bill-
for us.
Until they understand what single payer really means.
Bill, I'll give you the last word. We couldn't hear you. You're on Skype. I couldn't hear
Look,
you.
I watched Jimmy Kimmel again tonight. I mean, the guy makes the points. He's the guy that you should listen to because he has a dog in this fight. He has a kid. He knows what it's like. And I think all the rest of these people are deciding it because Koch is paying the money to the Republican Party, and they have to get a win for Trump. It's all about politics. It's not about human beings, and he's a human being.
Okay.